MedStar National Rehabilitation Hospital. Patient safety. Patient safety is defined as freedom from accidental injury when interacting in any way within the healthcare system. Hospitals are thought to be a safe environment for patients. But do you know there are things that can potentially harm a patient even in a hospital room? You heard correctly, even in a hospital room. What if one of the hospital's care providers forgets to pay attention on hand hygiene? Think of a patient trying to reach a call bell, or water pitcher, or an extra blanket or a urinal. What if the patient's bed is too high? Have you ever thought that tubes and drains have the risk of becoming twisted? And clutter in the room. These conditions are all risky and hazardous for a patient. Now, let's have a look at these scenarios in Jonathan's hospital room. A care provider with unwashed and contaminated hands examines Jonathan and he starts to feel worse, showing obvious signs of infection. Jonathan's bed was not on the right level, so when he tried to get up, he fell. Call bell was out of his reach, and when he tried to grab it, he fell. An extra blanket was not offered to him, so when he tried to grab it from the bottom of his bed, he fell. Tubes and drains have become twisted, and when he tried to get up, he tripped and he fell. Clutter in his room tripped him, and he fell. Jonathan fell over and over again while trying to reach for the water pitcher and the urinal. Poor Jonathan just wanted to be healed and to feel well enough to go home. But these scenarios may be reversed and Jonathan can happily go back home having been healed, feeling fit and healthy again. MedStar National Rehabilitation Hospital urges all care providers to pay close attention to patient safety to avoid accidental injury. Reference IOM.